Hello and welcome to Curioscope. Today we're covering the biggest healthcare stories making headlines around the world, including a major Ebola emergency in Africa, the latest updates on Mpox, ongoing bird flu surveillance, and promising vaccine developments. Let's begin. Story 1. Ebola emergency. The World Health Organization has declared the Ebola outbreak affecting the Democratic Republic of the Congo and Uganda a public health emergency of international concern, the highest level of global health alert. According to the WHO, the outbreak is being caused by the Bundibugyo strain of the Ebola virus, a rare variant for which no licensed vaccine or specific treatment currently exists. Reuters reported on June 9, 2026, that health authorities in the Democratic Republic of the Congo have confirmed nearly 600 Ebola cases, with more than 115 deaths recorded so far. The WHO warns that the virus may have been spreading undetected for months before it was officially identified, increasing the risk of wider transmission. Health officials are now racing to strengthen testing, contact tracing, and treatment efforts across affected regions. Story 2. Whose emergency response? In response to the growing outbreak, Reuters reported on June 5th that the World Health Organization has launched a 6-month Ebola response plan worth approximately $518 million. According to WHO officials, the funding will be used to support surveillance systems, laboratory testing, treatment centers, border screening, and emergency preparedness in neighboring countries. WHO Director General Dr. Tedros Adhanom Ghebreyesus stated that rapid action, adequate funding, and strong community engagement are essential to controlling the outbreak. Public health experts say early intervention remains the best defense against further spread. Story 3. Testing challenges. According to Reuters and WHO situation reports released this month, several laboratories in affected areas have faced shortages of critical testing supplies. Health authorities say these shortages temporarily reduced diagnostic capacity, making it harder to quickly identify and isolate infected individuals. The WHO notes that the Bundibugyo strain presents additional diagnostic challenges because some commonly used tests were not initially optimized for this particular Ebola variant. Experts warn that delays in testing can significantly impact outbreak control efforts. Story 4. Mpox update. Turning now to Mpox. The Pan-American Health Organization reported in its June 2026 situation update that multiple countries across the Americas continue to detect Mpox cases. According to PAHO surveillance data, nearly 1,000 cases have been reported across 10 countries this year, including infections linked to international travel. The World Health Organization says health agencies are paying close attention to the Clade 1b variant, which has been associated with recent international transmission events. While officials emphasize that current monitoring systems are functioning effectively, they continue to encourage vigilance and rapid reporting of suspected cases. Public health experts say surveillance remains crucial to preventing larger outbreaks. Story 5. Bird flu risks. Meanwhile, scientists around the world continue to closely monitor highly pathogenic avian influenza, commonly known as H5N1 bird flu. According to surveillance updates from the U.S. Centers for Disease Control and Prevention and the World Health Organization, there is currently no evidence of sustained human-to-human transmission. However, researchers remain concerned because influenza viruses constantly evolve. The CDC reports that ongoing outbreaks among birds and occasional infections in mammals highlight the importance of continued monitoring. According to influenza researchers, genomic surveillance programs are being used globally to detect mutations that could potentially increase transmission risks. Health authorities stress that preparedness today can help prevent future crises. Story 6. New vaccine breakthroughs. There is also encouraging news from the scientific community. According to the World Health Organization and the European Commission's Health Security Program, researchers are accelerating development of vaccines specifically targeting the Bundibugyo Ebola strain. Several vaccine candidates are currently being prepared for advanced testing and evaluation. Scientists involved in these programs say lessons learned during the COVID-19 pandemic have significantly improved the speed at which vaccines can be designed, tested, and deployed. The WHO also reports growing use of artificial intelligence and genomic surveillance technologies to identify emerging disease threats earlier than ever before. Researchers believe these innovations could dramatically improve future outbreak responses. Conclusion. To summarize today's global health update, according to the World Health Organization, Ebola remains the most urgent international public health emergency of 2026. Reuters reports that nearly 600 Ebola cases have been confirmed in Congo. The WHO has launched a response plan worth more than $500 million to combat the outbreak. The Pan American Health Organization continues monitoring Mpox cases across the Americas. The CDC and WHO remain alert to bird flu developments worldwide. And scientists, supported by international health organizations, are working to develop new vaccines that could strengthen global preparedness against future outbreaks. We'll continue following these important healthcare developments and bring you verified updates from trusted sources. If you found this report useful, subscribe to Curioscope and stay informed with the latest news in health, education, science, careers, and global developments. Thank you for watching.